significant development in intensive care regarding both diagnosis and therapeutic means, except that we are confronted with some problem of antibiotic resistance and the side effect of medication, making it difficult to reduce mortality from septic shock in intensive care units. And why not resort to this traditional Chinese medicine to improve this prognosis, to decrease the mortality for critical and illness patients. So I would like to say that pathophysiology of septic shock starts first of all by an infection trigger. Initial infection causes cascades of cytokine storms by TNF, alpha, and interleukin 1 to interleukin 6 release that gives a microcirculatory dysfunction and heterogeneity in flow that gives multi-organ failure by progressive dysfunction. Our medicine is very performant and very efficient, like the use of some samples, lactates in the first hour, culture, antibiotics, fluids, and the use of vasopressor. The use in the first hour of antimicrobial therapy with broad spectrum within an hour. The use of fluid resuscitation like crystalloid, 13 milliliter kg, but also the need of vasopressor like norepinephrine in the first slide. Understanding septic shock is that is life-threatening emergency, but there is a high mortality between 30 to 50 despite the protocols. This therapeutic art that is traditional Chinese medicine is based on an energetic vision of the man connected to the universe in accordance with the so-called Taoist thought, and it's absolutely opposite to our mechanical view of the human body that was passed down to us from the Enlightenment. Its history is millennia old manuscripts dating back 5,000 years refer to it, and it's still widely practiced across the Asian continent. The theory of traditional Chinese medicine is the circulation of vital energy flowing through the meridians, and the use of some therapeutic modality like acupuncture in intensive care units, electroacupuncture, but also the use of herb, moxibustion, and massage like a tuina. When we have a circulation of energy through the meridian, there is a good health that gives a good health to the organs system. The zinc is the full organs. The fu is the empty organs. The conceptualization of septic shock in traditional Chinese medicine is the head that is correlated with severe inflammation and high fever in our conventional medicine. The Qi deficiency is the energy depletion and the organ failure, but also a dampness. What is dampness? Is the fluid accumulation and edema. How we can integrate the TCM to modern healthcare? We can use the traditional Chinese medicine as a complementary approach to give potential synergy with different framework like phytotherapy, but also electroacupuncture to have an enhanced outcome and to improve the prognosis. We can use the electroacupuncture in the illness unit, the intensive care unit, but the use of plants gives an immune modulation proved by serious scientific studies like astragalus ginseng, atrasilode, UB gene. Remember these plants, UB gene is it's a star in traditional Chinese medicine. The best and the good news that in China they use the conditioning medication like our drugs and our medication in EV access, like astragalus by oral way, ginseng oral way, astralisul in oral way, but jubinjin in injection that can be used in through the EV access. Astragalus enhance macrophage function, ginseng modulate T cells differentiations, but xubigene injection reduce inflammatory and cytokines. Shen Fu injection gives balanced human response. But the effect of this kind of medication is that gives a good microcirculation regulation, like Danshan salvia, that promote vasodilation and reduce platelet aggregation. Xubigene injection improves perfused vessel density, and Shen Fu injection preserve endothelial glycocalyx integrity. Xubigene, the star of the plants in the TCM, is Chinese medicine preparation based on the formula, which consists to 5 Chinese herbs. Saffron, we know saffron, zafran in Arabic, Paoni lactifera, Rhizoma ling tici, Shangjiong, Salvia miltirizae, and Angelica sinensis that modulate cells differentiation and in 2021 with Xubigene injection in specific rats mitigate kidney injury and reduce cortical microcirculatory disorder and suppress activation of local inflammation. So within 72 hours of the using of this medication, with the decrease of and the reduction of interleukin 6, 42%, and in 30% the TNF alpha reduction, but also HMGB1 reduction about 45%. There is another study published in 2019 with the astragalus formula that reduced mortality risk by 32%. There is some trials used in China starting from 2010 to 2015. That was a single center, small sample, under 60 patients, but from 2000 to 15, it was to 2019, an expansion to multi-center design with improved methodologies, and sample size ranged from 100 to 300 patients. And from 2019 to 2024, there was a definitive large-scale studies, more than 70 incorporating international research standards and comprehensive biomarker analysis. But the important is the integration with modern healthcare can be a complementary approach to give potential synergy with our antibiotics and vasopressor, but also with the different framework like phytotherapy and acupuncture to give enhanced outcomes and to improve the prognosis. In worldwide, the regulatory approach to TCM varies significantly globally, because in China, they dedicated a department of TCM. They dedicated a TCM physician as core of intensive care unit team member, but also standardized injectable TCM formulation and national guideline incorporating TCM approach. In Europe, the Western European model is to have a consultant-based integration, a focus on research intervention, and emphasis on herb-drug interaction monitor and side effects. The model of North American model is to use TCM on demand, the standardized injectable TCM formulation, but also insisting quality and safety protocol emphasis, but also insist research-intensive approach to adoption. In conclusion, we can say that integrated critical care can use TCM to associated with modern intensive care combining convention, but also rigorous quality control for critical care herb and a multidisciplinary team for comprehensive assessments. I would like to invite you to the next international conference that will take place in Lisbon. Cici, it's thank you in Chinese language. I think I respect the time.
Younes, thank you so much for bringing us to think outside the box and
thank you.
having this amazing lecture. Two questions, please.
Yes.
This one is about drug development and how we can apply what we know about FDA and EMEA. So, are these drugs on the market? Can we use them, etc.? And my second question is about informed consent. I don't know how it is in Morocco, but for some of my patients in France, if I were to go to Chinese medicine, they would consider that their situation is over and that I'm looking for a rescue strategy. So you spoke very well about adding this to the classic treatment. So how do you do that when you think about it?
Yes, thank you for this interesting question. For me, I think that we can industrialize this kind of product that is available in China, and to give some relationship with some manufacturer in China, in Beijing, in more cities in China. But also, I can say that in my practice, I use first of all acupuncture for all. First of all, at the operating room for the pain management, but also I use it to the intensive care patients. That was I realized that it's effective. So for us, the best way to improve this kind of complementary alternative medicine is, and to have more efficacy, is that the doctors needs to be to have some courses about traditional Chinese medicine and to do acupuncture for their patients, to have more credibility against the patients, but against the public. So that's my reflection, and I think it could be possible in the future. It's not easy in the beginning, but I would like that it will be easy to have this availability of this kind of medicine.
So thank you for a really great talk. And I suppose just to reflect the acupuncture, absolutely. So certainly in the public sector in the UK, acupuncture is recognised as a standard of care, and it's used in anaesthesia, and it's used particularly in musculoskeletal, which might be very applicable, as you say, to our intensive care teams. And indeed, many of the drugs we use, things like the tacrolimus for a liver transplant or other transplants, was derived from plant-based medicine. So we must learn this. I suppose the one question is, we need to make sure that these products are beautifully produced, replicably produced, and that we can reflect the same study quality as you alluded to if we use it here. Because certainly the drugs that are used in India, similarly,
almost
is similar, is often contaminated. And that's what gives it the bad reputation. So just your thoughts about how we do that.
Okay, thank you.
In Switzerland, in my hospital, we use those approach more and more as global treatment of the
Yes.
patients, but mainly for treating dyspnea, discomfort, pain, etc., anxiety also. However, we apply those treatments by dedicated teams, and as I see a physician, we don't really have good knowledge on those things.
Courses.
And we ask consultants.
Yeah.
But what is your opinion about that? Should we learn about that as ICU physician and manage by ourselves those alternative treatments? Or should we collaborate with specialists of those alternative medicines?
So I need continuous courses, and to be comfortable with the TCM, we need to practice and to do courses. About TCM, it's possible to do it. I think 1 to 5 years it's enough to control and to have knowledge. But we need to practice every day for each patient, for the pre-operative patients, but also for in intensive care units, for all patients, all hospitals, all specialties. That's the way to learn with the efficiency. I think that's my reflection. But I think that's the best practitioner is doctors, is intensivist, is anesthesiologist. I think it will be a good thing to have more credibility against the public, against the patients, and against the institution to be reimbursable too. That's, I think it's a global thinking and it can works.
Thank you very much, Darius, for this amazing lecture. I know you were in China,
Yes.
and you involved with the Chinese practitioners in this care.
Yeah.
My question is, how does this work in practice? Thank
In
you.
practice, like I say in my lecture, that's in the medical system in all China, they incorporate the conventional medicine, very performant. You see, it's very important in China. But also they do a bridge between their traditional Chinese medicine to our conventional medicine. So they can use it in their hospitals. They do it daily and with the efficiency. So that's what I say. I've seen, and it works.
Thank you so much.